My name is Dr. Mussaad Al Razouki, and I represent Kleos Healthcare, which is a Kuwait-based, Middle East-focused healthcare development company. And we work mainly with both providers and government regulators to try to improve quality of care across the Middle East. The reason I'm here is because actually the reason I'm here is actually medical tourism makes up a very large portion of our healthcare spending. We did some analysis a few years ago where we realized that the 6 countries of the Gulf Cooperation Council spend roughly about $12 billion a year sending patients abroad. Now, of that, the government spends roughly 80%. So a lot of money tends to go from abroad. A lot of money tends to go from the region abroad, and we want to try and find ways to help not only improve the quality of healthcare in the region to help decrease that amount that gets sent abroad, but at the same time also improve the quality of patient care for those that do end up going abroad. So medical tourism is a big aspect of healthcare in our region, and that's why I'm here.
Great. Can you tell me about your role, how it ties into this conference?
So, I mean, as a private sector company, we're very interested in ways to improve quality. And what we'd hope to learn here at the conference is see how other regions do it, how other regions meet with their medical tourism needs, and also build connections with world-class providers to try and, again, improve quality of healthcare for the citizens of the Middle East. Sure, I think when it comes to education and healthcare, it touches upon the issue of quality. And quality is a very subjective means, but certainly I think anybody can agree that where a doctor is educated, or any healthcare practitioner for that matter, where they're educated is a very strong component of an indicator of their quality of healthcare delivery. Now, tie into that continuous medical education, because as any doctor or nurse or any healthcare practitioner knows, you don't just study in college or in university. You need to continue developing your healthcare expertise. So education is a very important aspect, and certainly not only governments but even private sector entities need to encourage further education, whether it's continuous medical education, and encourage that even further. So I think this event, it's my first time visiting here, and I've been very impressed with the caliber of speakers as well as the number of attendees. I think it highlights, importantly, how healthcare has become a global concern, and how the more healthcare enters the public agenda, the more of a hot topic it becomes. So certainly what the MTA has done, bringing this cadre of international experts together, I think is a very important milestone for our industry. Now, even more so, we do need to encourage, hopefully maybe another medical tourism event outside of the United States. That will make sense to me as well. I mean, the conference is just getting started, but something that I find very interesting, again, is just to see the different variety of nations involved. It's really like the United Nations of healthcare out there. And I've seen people from, I think, 5 different continents just this morning. And what it really brings into the foray is how healthcare is such a human element. And it doesn't matter if you're from Kuwait, where I'm from, or from or from Nevada, or from California, or from Jamaica. At the end of the day, it's about the core values of keeping your loved ones healthy. And I think that's what we're here to answer. I mean, to me, healthcare spending is a very tricky issue. A lot is spent on healthcare today globally, and a lot will continue to be spent as populations get older. Now, in a country like ours, like the Middle East, there is some money that's spent in country or in region, and a lot of money spent abroad. Now, we will always need to send patients abroad because globally, I think what we need to do as a healthcare industry is develop specialties in certain regions or in certain countries. There aren't that many, for example, tertiary care cases, and I can't pick a disease at random, but there are some diseases out there where you cannot have more than one global specialist. So I think as transportation becomes more accessible, as we encourage telemedicine and other forms of digital healthcare, it becomes much easier to really have a global healthcare system. So I can't make the case for saying that the Middle East should spend X amount of dollars, the US should spend X amount of dollars. I think globally we need to do a better job of pooling our resources for the future generation. I think today, when you look at medical tourism, people travel for 3 primary reasons, whether it's better access to care, better quality of care, or cheaper cost of care. Now, the Middle East itself is trying to develop its own medical tourism strategy. We certainly send a good number of patients abroad. When it comes to those three primary axes, where do we stand? Can we compete with, other Asian countries, China, Thailand, India, on the cost side? Can we compete with the West, well, let's say Europe and the US on the quality side? Or is it a question of access? Do we just provide a good cost, quality product, but grant access to whoever can come and enjoy it and make use of it? To me, that's something that needs to be defined. And I think the access pillar is probably the most important one for the Middle East as we develop our medical tourism strategy. I think the fears of traveling to the Middle East shouldn't be a concern. The Middle East is a very large portion of the world. The MENA regions, we like to call the Middle East and North Africa, represents about 300 million people, 22 different countries. Certainly there are some countries where the political dynamism is represented a bit negatively in the media, but that doesn't mean that there are certain parts of New York City that are difficult or are dangerous to visit. So at the same time, I think it's very important to realize that the Middle East is a very dynamic region. It is extremely safe to travel there, and certainly many countries welcome tourists. And ourselves as Arabs, we're very hospitable people. Arab hospitality has been known since the Middle Ages. So certainly today, I encourage anybody to come visit, whether it's for medical tourism or tourism in general. I think definitely healthcare providers are a very important pillar of the healthcare economy. They're the patient-facing ones. Many people, when you say healthcare, think of their doctor or their hospital. For us, again, as a private company based in the Middle East, we love to meet with world-class providers. And I feel I can learn just as much from a hospital in New York City as a hospital in Bangalore, India. To me, what certain hospitals are doing in remote places of Asia and remote places in Latin America, trying to address, again, the cost equation to deliver better care at cheaper economics. I think that's something that's very important for the future. Now, again, we need to be more global as a healthcare industry, and what this conference provides is really a global platform for discussion. Sure. Again, kind of building on the previous discussion we had, we need to be more global as a healthcare industry. What will work in Costa Rica or in Thailand could also work in Kuwait, in Qatar, in Dubai. And as our population is to grow older, we need to do a better job of learning from countries, probably like Japan, probably like the US, where the population is getting older and then resources are getting limited. So to me, again, it's about that global platform for discussion. And the more we can sit there, whether it's a roundtable or just via teleconference,
Right.
it's just good to see how other people are working at the similar problems we'll all be facing.